be brave if you're brave. I'll be brave, but only if you're brave. And it could be just you and me. We'll be family. Just wait and see. So I will fight if you'll fight. Yeah, I will fight, but only if you'll fight. Oh, we can make it through this like sailors in a tempest. Like sailors in a tempest together. And it could be just you and me. We'll be family. Just wait and see.
Good afternoon, everyone. Welcome to today's Lung Cancer Living Room. Thank you all for joining us live, and for those of you who will come back and join us post-live, we are thrilled to have you. For those of you who may not know me, I'm Danielle Hicks. I'm Chief Patient Officer at GoTo Foundation. So anything and everything that has to do with patient touch, I have my fingers in, including this program. We are thrilled today to have one of my colleagues on the East Coast, Wynn Boerckel, who's a licensed social worker working at Cancer Care, come and talk to us today. We're going to have a great conversation, I hope, around managing emotional well-being. I know for a lot of us, for a lot of you watching, having a conversation around managing those emotions with a lung cancer diagnosis and then putting, the state of our world today and those added stresses on top of it. We're hoping to be able to clarify a couple of things today and maybe give you some pointers on best practices on how to manage that. So thank you all for joining. I want to introduce Wynn. Hi, Wynn. It's very nice to have you. I thought maybe you could tell us a little bit about yourself, what your role is at Cancer Care. I know you mentioned earlier you've been there for 25 years, which is a huge accomplishment. So tell us a little bit about you and what you do over there.
Hi, Danielle. Thank you. I'm Cancer Care's Long Island office director of social services, and that covers the middle and eastern parts of Long Island, and that represents a population of about 3 million folks. I've been working for Cancer Care for 25 years, initially as a student intern social worker, and then just decided to stay there and have never left. In the process, early on in my career, Cancer Care decided that we needed to place a larger emphasis on our serving lung cancer patients, since we serve all diagnoses. And I got involved because I was running a wonderful support group of lung cancer patients at that time in their Manhattan office. And when I transferred out to Long Island, I kept it going. So we've been running a lung cancer support group on Long Island for 24 years, and it's without interruption. So I'm always very pleased and proud of that.
Thanks for that introduction, Wynn. We're going to talk, as I said, about emotional well-being, and I think, more importantly, how important it is to recognize when anxiety might be taking a front seat. So I'm going to jump right in and ask you to talk a little bit about some of the things that can affect our good emotional health as lung cancer patients, and then, address maybe some of the added stress that the virus may be having on patients.
Keep in mind that anxiety comes when we are not familiar with the situation, and certainly none of us ever expect to be diagnosed with lung cancer. It's just going to happen to someone else, and all of a sudden we're told in that doctor's office that you have stage 4, stage 1, stage 3 lung cancer. Don't know what he's talking about. Can't imagine, okay, what he or she is talking about, because the roar of the words lung cancer are so loud in our ears. And that's a communications issue. Maybe we can talk a little bit more about that. But I also want to kind of share that one of the things that happens when you get that diagnosis is that almost immediately you're moved from the land of the well to the land of lung cancer. You're placed in the lung cancer box. All of a sudden, your whole stature is diminished, and you are anxiously thinking, "Well, how do I get out of this? What can I do?" And also because oftentimes people are exposed to the stigma of lung cancer, it's a very, very hard place to move ourselves from. Um, so it's important to not allow ourselves to be sealed or locked into that box. And we need to start thinking about ways that we move away from it. Because one of the things is that if we stay in that box, then lung cancer is going to be the only things in our conscious lives. And that's the last thing we want to do. We want to be able to have lung cancer as being a part of our life, but not the defining every minute part of our life. The other thing is that there's a sense that because we have lung cancer, the folks around us, our loved ones, oftentimes feel that somehow they need to protect us. They know nothing about the cancer either, but what they want to do is they don't quite know how to be helpful, so they tend oftentimes to be over helpful, over protective. And that is something that we've got to be careful of, because one of the things is that we don't want the disease and the helping folks around us to take away our sense of independence, take away our sense of self. And oftentimes we'll find that family and friends will just want to do things for us. So it's something as simple as us getting up and getting a glass of water. All of a sudden someone appears with a glass of water in their hands. And well, that's nice. And sometimes we think, gee, this is pretty neat. I'm getting all this service. But that's when you have to say, whoa, I'm me. And if I can get up and get a glass of water, I want to make sure that I let other people know, thanks, but it's important that I can do things, and please let me do the things that I know I can do. I promise that I'll ask you when I need the help, but let me give it a try. And so when we do care, I do a wonderful caregivers group, and one of the things we try and tell them is that you've got to give your lung cancer patient, okay, options. People need to be able to say yes or no. And so instead of showing up with that glass of water in their hand, to say, would you like to get a glass of water, or would you like me to get it? Notice that the first part of the option was, would you like to? So that we're giving the patient that sense of being a capable, independent person. Now, that's a very small example, but it's something that we ask caregivers to keep in mind, that we want our lung cancer patients to feel that they are much more than just a lung cancer patient. They haven't been changed. They have lung cancer, but they haven't been changed from being the personalities that they are. And that's very important, because loss of independence, loss of sense of self is a really heavy strain on our emotional well-being. We need to have that feeling about ourselves. The other thing to keep in mind is that when we come into this lung cancer world, okay, it's a whole new world where we have to learn all of the communications pieces, because since we originally felt we were never going to get lung cancer, why would we have to know any of this stuff? But we have to know the language. What does metastasis mean? What does stage 1 mean? What's the difference between chemotherapy and immunotherapy? All these words and all of this. Some of it we're going to pick up, but it's very important when people use these words on us, okay, to ask them, well, what does that mean? It's important to have that sense, because without an understanding of the words, again, that it makes us anxious. It certainly screws up our emotional well-being to feel that we're kind of out of the loop. And so it is very important to stop people and say, hey, stop. I don't understand what you're talking about. And so often when we're talking with our medical care teams, we tend to let them talk on and on, and we don't really know what they're talking about. So for those of you as old as I am, you may remember Peter Falk as Inspector Columbo, and keep in mind that he never lost the case because he always kept asking questions. He never felt embarrassed that he had to ask questions, and that's how he learned, and that's how he mastered, each and every one of his detective cases. So again, language and is probably one of the most important parts of maintaining our emotional health. Being able to talk, to understand, to interpret. The other piece that I want to bring up is that lung cancer is a very specific cancer, and it's important not to let people confuse your cancer, with things, so that oftentimes people who want to be helpful feel that they need to tell you about their Aunt Betty's colorectal cancer or Uncle John's prostate cancer. And what happens is that they will go into long details irrelevant to the subject of lung cancer, and think that they're being helpful, and they're not. But one of the things that we have to watch out for when they do that is when they start talking about the problems and the issues. Oftentimes that builds up our anxiety, and it makes us feel like somehow that's going to happen to us, or that's what we're going to have to deal with as we progress in our lung cancer journey. And I think that I like the phrase that we coined in our lung cancer group a while back, and that is that we tell folks, don't ever try to wear anyone else's cancer, because it doesn't fit. The experiences of other folks, even other lung cancer patients, can really do some damage to our emotional health. We want to think about that as our cancer, and that's all we have to deal with, not the things that other people are coming up with for us. The other piece that comes to mind that is never very helpful is when we have people who are very ill-informed, but they tend to be the self-appointed counselors, that they tend to know it all about any cancer, including your lung cancer. And so there'll be things like, well, you should be seeing Dr. Schwartz. Dr. Schwartz is a urologist, but it doesn't matter to them. They're there because they know that Dr. Schwartz is the doctor for you, or they give you advice about what you should be eating or medications you should be taking. When people do that, the phrase, "What makes you say that?" is one of the ways that you can kind of put a stop to that. And usually what makes you say that, said in almost that tone of voice, can get folks to back off or decide that they'd rather not stay and talk with you anymore. But if it doesn't work, and if they come back one more time, you need to use that same phrase again with more emphasis and sort of a look of total disbelief on your face. That does it, because what you're saying, in a much nicer way, is, who made you the big authority? Those are some of the things that come to mind after you're initially diagnosed. That sense of not wanting to be in the box, not wanting to not be able to understand the terms, the culture, the processes, all of the things that you're going to be dealing with as you start treatment, as you progress through the treatment, to be able to communicate with your care team. And also, there are other pieces of that communication besides the care team. You want to be able to understand how to talk with family members, how to talk with your children about the diagnosis of lung cancer, how to communicate with the folks at work in terms of your supervisors or some of your colleagues. All of these things require a new sense and a new strategy of communications. And that's where, if going to appropriate websites, can be very, very helpful. Talking with counselors at the various lung cancer resource organizations can be something that helps you with this whole range of new communications.
I guess, one of the questions that I would have and would love your opinion on is, does everyone need to know the language and be educated? Because I know, historically I've worked with patients who are like, it's too much information, it's overwhelming, it's adding to my anxiety. And maybe we could talk a little bit about, you know, those sort of open-ended conversations and the communications that you're talking about, and how patients can maybe go to a family member or a friend, or maybe utilize one of the resources from the multiple foundations out there, to help kind of them to manage that, because it can be that the education all by itself can be very overwhelming.
That's a great point, and people should educate to the point that they feel that they know enough to work through and live in the cancer in the lung cancer environment. That you don't have to know exactly what the oncologist is doing drug wise, but you have to be comfortable that your course of drugs when you first start with cancer, okay, will be a certain type, and it can be helpful to at least understand how to cope with your chemotherapy. And initially, you bring in information to the extent that you need it, and as you progress through your lung cancer experience, you keep adding to it. Just the way you did when you started school. You didn't know algebra when you went to kindergarten.
One of the other things you talked about are over helpful family and friends. And I know firsthand, for those of you watching, some of you may not know, I think most people do at this point, that Bonnie is my mom. And I remember when she was diagnosed back in 2003, my knee-jerk reaction was to do everything, to pick up everything for her, to help wherever I could without asking. Unknowingly doing so was making her feel a loss of independence. And so I think it's a really great point that you made, because I know I was guilty of it, and it was not coming from any place of malice or wanting her to think that she couldn't do it. It was just trying to be helpful. So I think it's really important for people diagnosed with lung cancer, any cancer or disease, really, to have that conversation with their loved one. It may be a tough conversation, but I think that most caregivers, family, friends, whoever, don't realize that what they're doing is actually adding to the stress and the anxiety level.
Yeah, and one of my clients, I love the way she handled it. She told her adult son and daughter, she said, I love you both very much, and you're doing such wonderful things for me. But she said, my sense is that we're going to be in this for the long run. And she said, so I don't want you guys burning out. I want you to work with me as a team. All three of us, okay, can work on my care, but you got to give me the space to do what I need to do and what I can do and what I want to do. And I just thought that the way she, kind of used that, she was expressing the fact that her care for them was important, and part of allowing her to be a part and participate in what all had to be done was said in care, as much as her son and daughter were doing, kind of overdoing it in loving care, because we don't, when that first happens, we don't know what else to do, but we know we want to do as much as possible out of love and care.
Correct. I remember my mom saying back then, that although she appreciated and understood that it was coming from a good place, that she was still a mother, she was still a wife, she was still a friend, she was still all of these other things. It made her feel that she was defined solely by her diagnosis, as opposed to all these other amazing things that she was. So I think that's a really amazing point. A couple of things that that we didn't talk about, but that I think is important, also, is the tendency, especially early on at diagnosis, for folks to blame themselves for things that may have contributed to their diagnosis, particularly in lung cancer, if and for those folks who may have had a smoking history. What are your thoughts on that sort of shame blame thing in this space, and how it adds to anxiety?
It's a wonderful point, and we live in a society where when something happens, whether it's a fender dent or a building burning down, the first reaction is somebody's to blame for this. Something
Yeah.
something caused this. So you don't have to blame yourself with lung cancer, because there's a whole bunch of people just standing by ready to do it for you. Um, so it you have to think about society in general. They are if they hear lung cancer, the first thing often many of the rudes say was, "Oh, lung cancer. Well, you must have smoked." Thank you very much. You don't know a thing about me.
Hmm.
Um,
Hmm.
other times, there'll be at the family level. Sometimes there will be, if you were a smoker, there's that thing that, well, if you'd really love me and stop smoking when I asked you, we wouldn't be in this financial disaster. Um, and then there's the other piece of that self blame, which you just mentioned, Daniel, where there's that sense of, well, I brought this on myself, so I'm not going to go to any big special cancer care. I'll just go to the local hospital, or maybe I'm just going to ignore this, and do really stupid things. And so it's important to do the smart thing and to focus on today, and just remember that history is something that can't be changed, but what can be changed is today. And if we focus on staying in sync with today, and focusing on learning about our cancer, learning and how to communicate with our doctors and things like that. And we put that effort that when goes into beating ourselves up into helping ourselves up. I think that's the way to do it. And probably the key part of that is that history can't be changed, but today can. And if I'm a lung cancer patient, I'm going to change everything I possibly can to make this as good an experience as it can be for me and for my loved ones.
How important do you feel it is for folks to set new expectations based on their new situation versus trying to manage expectations from sort of a before cancer diagnosis, or before lung cancer diagnosis?
And interesting enough, that sort of segues nicely into the guilt, because sometimes that can be mixed into it, where before cancer, BC, there we were able to do a 5 mile run, and now we can't walk to the mailbox on the corner. And so
Right.
and yet we are so down on ourselves because we can't do that 5 mile run. We keep saying, well, I could do this and I could do that. Instead, what we really need to be doing to handle our emotional health is to set realistic expectations that reflect today's abilities. And so to be able to say, well, I walked beyond the mailbox. I got down to the firehouse further down the street, and I turned around and came back. Okay, we've just set ourselves a new expectation. Tomorrow, let's try the firehouse again. And at some point, maybe we can go a little bit beyond the firehouse. So it is important to set realistic expectations, because if we drag the expectations of before cancer into our lives, it's kind of like dragging a suitcase with a 200-pound anvil in it. We're just not going to have the emotional health. We're going to be continually down on ourselves, nagging ourselves, and criticizing ourselves for something that is so unrealistic. So self-expectations are a very important part of creating and maintaining a healthy emotional state.
There's a tendency for a lot of us when bad things happen, but in particular for patients diagnosed with lung cancer, of creating and sort of imagining these worst case scenarios in your future, or even next week because of the diagnosis, and then maybe trying to solve them. But this generates these negative sort of automatic thoughts that, quite often maybe have no basis in fact, but are rather our own minds just unable to quiet down for a moment and kind of, going from that one thought to the next thought and generating that negativity. Can you talk a little bit about that?
Yeah, I think you put it out two things that we really want to look at, and one is kind of creating the future and trying to solve it, and the other piece is the automatic thoughts. So first part of it is that in our lives we are awarded, applauded, and promoted, okay, for being good planners, for thinking ahead, for creating the right budget in our business, or for putting together the perfect birthday party, or things like that. So it's our nature to plan ahead and to look ahead, and that works in almost every facet of life until you're dealing with cancer. And when you're dealing with cancer and you start to think of the future, and you'll have people saying, well, if I'm around, I'm not sure I'm going to be there, but I wonder, or saying, well, I'll probably be so sick that Janie won't be able to care for me. How are we going to do that? How we're going to afford that? And so we we create these kind of black fairy tales that have no basis in fact. We don't know what's going to happen or what's not going to happen out there in the future. We create them, and then we try to solve them. And what we're doing is we're wasting our psychological energy, the energy that we should be applying to today's problems. Today, we've got the facts for what's wrong with today and what needs to be fixed today and what we need to be doing. But instead, we're applying the energy that we need for that to these worst case scenarios. So it's easy for me to say, all you have to do is stay in the moment. And it's a difficult thing to do, to keep bringing yourself back to today when you're just out, casting out all of these terrible scenarios. And so it's important to stay in the moment. And sometimes if you have come up with some type of a mantra or something to remind yourself when you start to do that, it can be helpful. I had one fellow who I was seeing for individual counseling with lung cancer, and when he started to go out into the future like that, he had a small rubber band on his wrist and he would snap it. I said, well, doesn't that hurt? And he said, yeah. But he said, that's today's pain. And he said, that reminds me of today. I don't recommend rubber bands, but I'm just saying that that's what he did, because he did want to stay in today. The other thing that connects to that is that throughout our lives, we create independent thoughts, thoughts that sometimes are helpful thoughts, so that when we know that if we get too close to the radiator or the campfire, okay, we feel the heat and we step back. It's an automatic thought that, hey, I need to be careful. And so those are helpful automatic thoughts. One of the things is, though, that when we're dealing in some type of a critical or crisis situation like lung cancer, we oftentimes create automatic thoughts that are negative. And so when we hear about a new treatment that might very well work for us, we say, well, nothing's worked so far. I'm not even going to ask the doctor about that. That sounds ridiculous. There's no point in my researching that. One of the things that we have to do is to create replacement thoughts, automatic thoughts that we can replace the negative ones. And so one of the things is that we need to say, well, so what supports that negative thought? And we think back, and the doctors never told us nothing is ever going to work, that you're a hopeless case. The doctors have said, well, your last chemotherapy was helpful in that you were stable and there was no disease regression, but it held off any disease progression. And so instead of your automatic thoughts that nothing's going to work for me, I'm never going to ask, when you hear the news of good treatment. The replacement thought would be, you know, that sounds interesting. I'm going to talk with the doc about that, because I'd be interested in that, if it is something that he or she thinks would be a good direction for me. So we just replaced that negative thought, nothing's going to work, to the thought, let's look into that.
And talking with folks over, the last over a decade now, I always tell them, it's okay to have your moments. Expect you're going to have your moments, right? But living in them is where things get, even scarier than they already are, especially from an anxiety and mental health issue. And we know that, keeping your head in the game is a very large part of the battle. And to your point earlier, easier said than done, right? So developing these tools and having them in your toolbox, whether it's a mantra or a rubber band or a friend that you can call up with some sort of a buzzword saying, I'm in this space and I need your help to get me out of it. But really thinking through and understanding and recognizing that those times will come and being prepared for them when they come, I think is a really, really valid point.
I like something you just said, which was giving yourself permission for something.
Yeah.
And one of the things that I frequently give my clients permission is it's okay to cry. So in my office, hanging on the wall near where we usually sit and talk, it was a little sign that says "Crying spoken here." Okay, because we are in this a society that absolutely falls apart the minute they see a tear or see us crying, and they rush over to tell us, "Don't cry, everything's going to be fine. Stop crying." And crying, in many ways, can be therapeutic, in that it allows us to put feelings so strong that we can't put them into words, into still expressing them. And in doing so, at some point we stop, we take a deep breath, maybe we blow our nose, and we feel that whatever it was that was making us so anxious that we were crying has at least temporarily been lifted from our shoulders. And that's so important. There's something that I call contract crying, in that you're in a staff meeting with the boss and all the top brass, and you're thinking of something that the doctor has said yesterday, and you realize that you want to burst into tears. And if you can, what you do is you make a contract with yourself and say that at 7 o'clock tonight, okay, well, when I'm home, I'm going to go downstairs into the rec room, lock the door, okay, and I'm going to have that good cry.
Right.
And because they've just done something about that feeling, and the thing is, if you make that contract, you better live up to it. You better not have that 7 o'clock cry. But I've had a few people who've been in business who have come back to me and said, Win, thank you, because that has really helped. I've been much less anxious about that happening at work, and I'm still able to express those feelings. So again, whatever you want to call it, but it can be very helpful, and crying can be helpful. There's a social work tool called partializing. And usually when we're anxious, it's because there's more than one thing, okay, that is causing that anxiety stress. And we usually reach anxiety, and we may think it's only one thing, but it's kind of what we've done is we've lumped everything into one big, insurmountable problem or issue that about our lung cancer that makes us so anxious. Sometimes I think it's helpful to grab a pad and a pencil and just sit down and write all of the things that are giving me this feeling of being anxious. And once I've listed them and put them out there, I say, okay, now what's the thing that's the biggest piece of my anxiety? Let me focus just on that. And so we do, and we find that thinking it through, using some things like you suggested in terms of saying, well, how have I dealt with something like this in the past before I had cancer? So now we've taken care of maybe one of the larger pieces of the anxiety, and we feel pretty good about it. So we say, okay, let me take on another piece. So what we've done is we've taken this big, overwhelming piece, and broken it down into manageable parts. And once we start managing it, we feel pretty good that we are in control and are able to deal with it. And when we've done that, we recognize that we've just created or recreated, reached into the past, and come up with a very powerful tool in dealing with our anxiety and helping us with our emotional well-being.
I want to discuss, to some degree, how the recent COVID-19 pandemic has added some anxiety and stress, on top of lung cancer patients already, high level of anxiety and stress, depending upon where they are in their cancer journey. Have you talked to patients about this? How are they managing? And, especially in a time when people are sheltering in place and maybe not allowed out of their homes to go to their coping space, whether it's to walk on a trail or sit on a beach or have a cup of coffee with a friend.
Yeah, it has made things so much more difficult in terms of maintaining a healthy balance emotionally. So one of the things that I run into oftentimes in talking with clients is that they say, "Oh, all I really want is a hug, okay, from my granddaughter." I would we are a touching uh, population, and we soothe, we care for each other, and we provide the solace oftentimes through touch, through a hug, as well as physical presence. Clients say that I am so tired of interacting with my beautiful grandchildren on Zoom. It's helpful, but it's not having the grandchildren there talking in their usual and normal voices, or watching them play in your living room and just so happy that they could come over for this afternoon. So that's been one of the things of staying in place that has made much more difficult to maintain emotional well-being. The other piece is that you go for your appointment, and it used to be wonderful to go for your appointment and have a very good friend or a spouse or a family member go with you. And we at Cancer Care always encourage people to have that second set of ears go and talk with the physician. And of course now they're not allowed to come into the building with you, and you sit alone in the waiting room before you talk with your doctor. And one of the other pieces was that when they came in with you, they would listen to the doctor. You would ask questions. Maybe they would ask a question. And after it was over, okay, you and whoever came with you for the appointment, we encouraged you to either sit down right away in the waiting room or go out to the car. Do not turn on the ignition, but sit and recreate all that you heard. So, if you were in the military, it would be called a debriefing, where you would put together what everyone has heard and come up with an overall summary of the important information. So we do encourage people now, if they're going solo because of the COVID restrictions, to write down, okay, everything the doctor tells you or that you think is important. And as soon as you get out to the car where your companion has been waiting, is to replay everything you've heard, go over and talk about it. And as Danielle has been talking throughout today's session, how important it is to have other people to talk with, because if we keep information inside us, if we keep things inside us, it doesn't do much good there. We need to talk. We need to talk about what we've heard. We need to talk about what we've experienced to others. That's why support groups are so important, because we have people who come and listen attentively. And what that has been taken away from us to some extent. And so to overcome it, we have to be able to do more talking to people who are important listeners for us. And we all have important listeners. And we need to keep that important and be able to thank them and express our gratitude for them to being around us and listening.
Yeah, I couldn't agree with you more, especially when talking about support groups. And I know you've had one for 24 4 years, I think you said.
4 years. Yeah.
Yeah, going on, which is incredible, and the living room's been going all along for about 11 years now. And I think one of the things that was so important to us when we were setting this up was for patients to be able to be with one another and to be able to have a conversation with someone who gets it, right? Someone who may not be on the same therapy, but especially from an anxiety level, right? Or from a frustration level because their spouse or their kid or somebody won't stop getting the water. You know what I mean? Where they may feel bad about telling their loved one that they are being overbearing, but having another patient who's walking in very similar shoes to talk to is in my experience with the folks that I've worked with, has been an insanely positive um, part of this whole process. So, with that, we talked a lot about thinking around anxiety, keeping our head in the game, particularly, Wynn came up with some great ideas and tools around managing anxiety when feeling despair and hopelessness, and flipping that on its head and finding the silver lining. We could all use silver linings in our lives, and some days they feel more impossible to find than others, but if we look hard enough, I tend to believe that they are out there. We did get a question online where folks are asking, and or maybe they're just giving some more tools and tips around journaling or maybe even art therapy, and being able to express yourself in that sort of a way. When do you have any experience with the folks you've worked with doing that sort of mindful therapy?
Yes, I encourage almost everyone I talk with. Not everyone picks up on it. The importance of journaling. Usually, they will be making a comment about how helpful it is to be able to come in and talk on a weekly or biweekly basis. And I tell them, well, one of the things is I can't be with you 24/7, and it's so important when you talk is you hear, okay, what you've been carrying around, and you hear yourself say it, and when it comes out, okay, it's not quite as big or quite as scary. And I said the same thing is going to happen when you use your journal, and when you see it written down there, it's out of you, it's no longer in you, and it's not quite as big as scary when you're looking at it down there on paper. Similarly, art therapy is another wonderful way, whatever whatever type of art you're working with, to express these inner feelings and being able to put them out. I like art therapy because in many ways, it's not only expressing the idea, but you're using your body, okay, to move and create, whether it's sculpture or painting or quilting or anything else. It's kind of using an extra part of our whole neural system as part of the expression. I think that's great. I think it's a wonderful way to get it and put it out. So I appreciate you bringing it up, because I am a real journaling fan, but I also have learned from so many of my clients how many other things there are out there that can be used to express, rather than carry these really anxious moments and thoughts around with us.
Yeah, I couldn't agree more. And, whether that's something that you do for yourself on a personal level, I know I work with, or I am friends actually with a patient out on the East Coast, and she's very big on her art therapy and sharing it through social media. She's got a very tight, community of lung cancer family, as we call it, and she always does such beautiful work, and her expressions, I think, and her willingness to share some of that with the lung cancer community, I know, is very welcome. So for those who are comfortable sharing, of course, nobody has to. It's been a really big eye opener for me to see not only the work that she's done, but how the community is responding to it. And conversely, somebody out here in California who does journaling and poetry around sort of some of these feelings, and then shares them with with the lung cancer community, and that's always a very welcome a very welcome gesture for those who are willing to share. And again, Wynn, I cannot thank you enough for taking 2 hours now out of your last week or so to bring all of this information and your wealth of knowledge to us. Thanks, everybody. Enjoy the rest of your Tuesday, and we will see you soon. Bye bye.
Oh, I'll be brave if you're brave. I'll be brave, but only if you're brave. And it could be just you and me. We'll be family. Just wait and see. So I will fight if you'll fight. Yeah, I will fight, but only if you'll fight. Oh, we can make it through this like sailors in a tempest. Like sailors in a tempest together. And it could be just you and me. We'll be family. Just wait and see.